You've probably heard about the incredibly popular GLP-1 medications for weight loss and diabetes. But alongside their rise, there's a growing conversation about a potential link to gallbladder health. In this explainer, we're going to break down the science and the data behind this connection so you can really understand what the research is telling us.
We'll start by looking at why these drugs are seen as so revolutionary to begin with. Then we'll dive into this emerging concern about the gallbladder and break down what the risk numbers actually are. We'll also explore the biology of why this might be happening, and then wrap up with what's probably the most important part, what all of this means for patients.
So before we can even begin to talk about potential risks, it's really essential to understand the context. Why have these medications become so common in the first place? And it all starts with their significant and proven benefits.
GLP-1 receptor agonists, they're not just another pill. They really represent a fundamental shift in how we approach some of the most common chronic health conditions, and that's not just hype. Their impact is backed by some really extensive clinical evidence.
Yeah, the evidence for these drugs is pretty powerful. We all know about their effects on diabetes and weight loss, but studies have also shown they can help protect both the heart and the kidneys. It's really this wide range of benefits that has made them a go-to therapy for literally millions of people.
All right, so now that millions of people are using these medications, we're starting to get a much more detailed picture from all the large-scale data that's coming in. And that includes, of course, a better understanding of potential side effects.
And that naturally leads to a crucial question. As these drugs become more and more common, what else are we learning about potential risks? It's important to remember, this is a totally standard part of the process for monitoring any new, widely adopted medication.
Well, the answer comes from a huge meta-analysis. That's a type of study that pulls together the results of many other trials, in this case, 76 of them. And the conclusion was pretty clear. These drugs are associated with a significantly increased risk of gallbladder and biliary diseases. That's the system that creates and stores bile.
So, what does increased risk actually mean in real numbers? Let's dig into the data from this massive study, which looked at over 100,000 patients, to find out.
The main finding was a 37% overall increase in relative risk. Now, it's really important to understand what this means. It does not mean that 37% of people on the drug will get gallbladder disease. It just means that, compared to a group not taking the medication, the risk is about 1/3 higher.
But the story gets a lot more nuanced when you look at why the drug is being prescribed. As this chart shows, the difference is pretty stark. For patients using it to manage diabetes, the risk increase is around 27%. But for those using it specifically for weight loss, that risk more than doubles, jumping all the way to 129%. This is an absolutely critical distinction.
And that big difference is closely tied to the dosage. The data shows a very clear dose-dependent relationship. The higher doses, which are the ones typically used for weight management, are the ones that carry that significantly elevated risk. In contrast, the lower doses didn't actually show a statistically significant increase at all.
Time is also a big factor here. The risk seems to be cumulative, really only becoming significant after about 6 months of continuous use. Shorter treatment periods just didn't show that same level of risk, which suggests the effect kind of builds up over time.
So, we've seen what the data shows. Now let's explore the why. What's the actual biological mechanism that connects these drugs to problems with the gallbladder?
To understand how this works, we need to quickly talk about a hormone called cholecystokinin, or CCK for short. Just think of it as a messenger. After you eat a meal, CCK is released, and it's the signal that tells your gallbladder, okay, it's time to contract and release some bile to help with digestion. So this is basically the chain of events. Research suggests that GLP-1 drugs can suppress that CCK signal. This leads to weaker and less complete gallbladder contractions. Now, when the gallbladder doesn't empty out properly, the bile just sits there, and it can become stagnant. And over time, that stagnant bile can thicken up into what's called sludge and eventually crystallize, forming gallstones. And there's another layer to this. Rapid weight loss, all by itself, is a well-known risk factor for gallstones. That's because it changes the very composition of your bile, making it more likely to form stones. So, for patients taking these drugs for weight loss, you've got this kind of dual mechanism at play. The drug's effect on the gallbladder's movement, compounded by the effect of rapid weight loss on the bile itself. And this really helps explain that much higher risk we saw earlier.
So, with all this information, the data, the biology, what does it all actually mean for patients? Let's turn to the practical signs and the big takeaways here.
Just being informed about the potential symptoms of gallbladder issues is really key.
The most common signs include a persistent pain in the upper right side of your abdomen, and that's often accompanied by nausea and vomiting. The area might also feel tender when you touch it, and sometimes you might run a low-grade fever. So let's just quickly pull together the primary risk factors we've covered. The risk is greatest for those using the drug specifically for weight loss. That often means they're on higher doses, they're taking it for longer than 6 months, and they're experiencing rapid weight loss. We're talking more than about 3 pounds a week.
So after looking at all this data, what's really the key message you should walk away with?
The main takeaway here isn't meant to be alarming, but really just to be informative. The increased risk is real and it's well documented, especially for those who are using higher doses for weight loss. The most constructive approach is simply to be aware of the potential symptoms and, most importantly, to maintain an open dialogue with your doctor. This allows you to make informed, shared decisions about the benefits and the risks, which is really the whole point of understanding this science.